Hello, Dr. James Bogash, expert in health and longevity, and today we're going to talk about prostate cancer and how to survive it. I guess would be the best thing is to not get prostate cancer in the first place. However, if you happen to develop it, there are absolutely, positively, without a doubt, choices that you can make that will extend your survival, most likely indefinitely. And so this was a large study looking at people who were diagnosed with prostate cancer, and they found that they followed them over the course of 6.4 years, so almost 6.5 years, and they found that markers of inflammation and markers of prediabetes actually increase the risk of progression of prostate cancer. Now that should not come as a big surprise. We've seen loads of studies over the years that link these two. But this brings up the topic of AS, or active surveillance, which is an interesting topic and one that 20 years ago nobody would entertain. The idea that somebody got a diagnosis of prostate cancer and you would just wait and see how it turns out, like nobody thinks that way, right? It's cancer, we got to rip it out, take it out, regardless of whether impotence or anything that happens, it's worth it to get rid of that prostate cancer. Well, turns out that so long as your certain markers like the Gleason score are in line, many people can undergo what's called active surveillance. And the problem with this is that it took a long time for researchers to get enough people who wanted to do active surveillance because, my God, it's cancer. We find it and we need to eradicate it with a nuclear bomb. We can't just let it sit there in our bodies. Well, ultimately, we've seen studies on active surveillance, and the outcomes are very good. And that is so basically somebody's diagnosed with active surveillance or with prostate cancer. As long as it's not indication of being aggressive, they just kind of sit back and watch it. Keep an eye on PSA levels, maybe usually not biopsy, but MRI or something to image the prostate. And the outcomes are generally good, but that's when people don't even... So the outcomes are good when you don't change anything that put you there in the first place. So your lifestyle, it's pro-inflammatory and pro-diabetic, increases the risk of prostate cancer. You get diagnosed with prostate cancer, don't change a damn thing, and your odds are still pretty good. So that's what we do in camps. That's what active surveillance is. For me, it would make a lot of sense that if you were diagnosed with prostate cancer, you would do everything possible to turn that around. And that's all diet, exercise, environmental chemical exposure. There's a lot of things we can do to bring inflammation and prediabetes back in check. Or you can just wing it. Not my preferred method, but you can just wing it. And in general, people with active surveillance, so long as they met the criteria, do well. So as always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.